So today I'm going to talk to you some post-operative instructions after your dental implant here today. You're going to have some sutures along those sites where the implant was placed. They're basically going to melt away. We have two different kinds actually. One will melt away and the other one is a silk suture that's left in place for about a week. So it just depends on what suture the doctor would like to use. If it is the silk suture, you'll come back in a week and we'll just clip that out. Very simple, you don't need to get numb for it or anything, and it comes right out nicely, okay? Basically today, as far as food, we just say chew on the other side. More softer foods for you. You can definitely chew over the implant site. We just say soft, real soft food would be the best. No hard, dense bolus of food over that implant site until you actually get your crown. It's fine that, soft things get over there, just nothing hard or crunchy things along that line. You can also do some warm saltwater rinses. It'll help shrink and heal that tissue for you. You'll have 3 prescriptions for you today. The first one is Motrin 600 milligrams that you'll start with right away. It's 1 tablet every 6 hours. That one is going to help with inflammation and constantly give you mild to moderate pain relief. If you require something a little bit more, we wrote for a higher dose pain medication, which is a narcotic called Percocet. Percocet is 1 or 2 every 4 to 6 hours for pain. If you take any narcotic pain medications, it's always good to have something to eat with it, because sometimes you can always get stomach upset with that. So just be careful with that. No driving a car or working with machinery if you do take that narcotic pain medication. And lastly, the one that we also give for infections is an antibiotic. You'll take that for about a week just to make sure you get no infections in the area. So it'll be just as a preventative for you, okay? So basically just warm saltwater rinses. You can certainly brush over that site after the next day or so. It might be a little bit tender, which is very normal. Soft bristle brush, going very carefully over that implant site to keep it clean and shiny, okay? Free of plaque. That's the best thing. No smoking if you're a smoker. That's very detrimental to the implant site and it will not heal correctly. So if you're a smoker, please do not smoke if you can help it. So I'd like to cover with you, in case you have a dental implant in the maxilla region, meaning the upper region of your jaw. Sometimes when we're working close to the sinus cavity, you may have a small trickle of blood that may come from your nose, which is very normal. It's because we're working close with the sinus and that can happen. It'll definitely go away. It doesn't keep pouring blood out or anything like that. It'll just go away basically on its own. So I just wanted to give you that information and not have you be scared about that procedure. So basically I'm just going to give you this post-operative care instruction sheet to review. If you have any questions, you can certainly reach our website at northeastsurgical.com for more further information. Okay, you did great.